Hi everyone, I'm about to report the Cognitive Behavioral Therapy or CBT. First, let's go to the history of CBT. The evolution of cognitive behavioral therapy can be traced back to the developments in psychology as early as 1913. The practice of CBT grew in the mid-1970s to aid in the treatment of higher functioning patients. This transition did not happen automatically but rather through the trial and error and the development in areas of behavioral therapy and better understanding of emotional self-control. So now we can go to the founders and pioneers of CBT. First, we have Dr. Albert Ellis. He was the pioneer of behavior therapy in the 1950s. His work with irrational thinking was the foundation in the development of CBT. His ABC technique of irrational beliefs is still utilized in CBT today. Next one is Dr. Aaron Beck. He is the father of cognition behavior therapy movement. His work began as a clinician in 1960s. His approach to psychotherapy at that time was radical and groundbreaking. And the last one is actually the daughter of Aaron Beck, which is Judith Beck. And Judith Beck is a significant impact on cognitive behavior therapy as well. She followed her father's path in research and development of treatments significant in cognitive behavioral therapy. Now we can go to the cognitive behavioral therapy. CBT is a form of talking therapy which can be used to treat people with a wide range of mental health problems. So basically, we can use CBT in helping people who are suffering from mental health problems. As we go on later, I will share with you what are those mental health problems are that CBT can treat. The next one is CBT aims to help people become aware of when they make negative interpretations and of behavioral patterns which reinforce the distorted thinking. Cognitive therapy helps people to develop alternative ways of thinking and behaving which aims to reduce their psychological distress. CBT is based on the idea that how we think, how we feel, and how we act all interacts together. Specifically, all our thoughts determine our feelings and our behavior. So, dito na pumapasok yung kung paano tayo mag-isip. We are always thinking every day. We think, and sometimes we overthink. This is where CBT comes in. Kapag tayo nag-overthink, tapos due to overthinking, nag-iisip na tayo ng mga hindi magagandang bagay or na dahil sa pag-overthink, yung ginagawa natin naapektuhan na, yun ang itinitreat ng CBT. Doon na tayo nagkakaroon ng problema. Cognitive behavioral therapy is in fact an umbrella term for many different therapies that can share some common elements. Two of the earliest form of cognitive behavioral therapy were rational emotive behavior therapy, which is RBT, developed by Albert Ellis in the 1950s, and cognitive therapy developed by Aaron T. Beck in the 1960s. So I will not be discussing that kasi merong ibang magdi-discuss dyan. So, let's go to the next one. CBT is a way of focusing on the cognitive processes that produce feelings. The approach helps by changing people's behavior and attitudes with a deeper understanding of thoughts, images, beliefs, and attitudes. This treatment is customized for each patient with regard to differences in personalities and specific needs. CBT can be viewed as an umbrella term for many different forms of therapies aimed at correcting dysfunctional cognition and maladaptive behaviors. And the last one is CBT allows patients to interrupt these thoughts with a deeper understanding of the errors or distortions in the perceptions of these automatic thoughts. This type of therapy helps patient to correct misinterpretations of the thoughts that have caused disruptions in their daily lives. So, katulad nga ng sinabi ko kanina, CBT is based on our thoughts, our behavior, based on our thoughts. In general, it is a goal-oriented psychotherapy treatment that takes a hands-on, practical approach to problem solving. Its goals is to change patterns of thinking or behavior that are behind people's difficulties, and also to change the way they feel. So, for example, have you heard of the phrase, overthinking kills? Well, hindi naman tayo mamamatay pag nag-overthink tayo, but sabi nga nila, lahat daw ng sobra masama. So, for example, yung boyfriend mo or husband mo is an army. So, let's say, he's an army, he is to Mindanao. And then, on a daily basis, lagi siyang tumatawag, nagte-text sa'yo, lagi kayong nagko-communicate. Then, one day, bigla na lang siyang hindi nag-text, hindi na lang siya tumawag, hindi na siya nagparamdam. This lasted for 1 week, pinakamatagal, worst case, 1 week. Then, ikaw, na naghihintay ng text, mag-overthink ka na. Kung ano-ano nang pumapasok sa isip mo, na baka kung ano nang nangyari sa kanila, na baka kung may nangyari ng masama sa kanila, ano kayang nangyayari, ganito, ganyan. First, hindi ka pa masyadong mag-aalala since naiintindihan mo pa na baka may ginagawa lang, ganito. But, pang tumatagal, nag-formulate na tayo ng mga conclusion, ng mga scenario sa isip natin, kung ano ba yung nangyayari. And sometimes, our brain focuses on the negative thoughts. And dito napapasok yung how we feel, how we think, and how we act. Magsasama-sama na siya. So, ikaw, na naghihintay ng sagot na hanggang ngayon, wala pa, ganyan, isip ka na ng kung ano-ano. Then, kapag these thoughts already is your life, na hindi ka na papasok sa trabaho, na nakakalimutan mo ng alagaan yung sarili mo, na hindi ka na nakaka-focus sa pag-aaral mo dahil kung ano-ano nang pumapasok sa isip mo, ganyan. This is considered as dysfunctional cognition or having a maladaptive behavior. Pumapasok yung CBT kasi, as I can say kanina, CBT helps patients to correct misinterpretations of the thoughts that have caused disruptions in their daily life. Kung talagang sobra na nagkakaroon ka na ng anxiety, nade-depress ka na, ganyan, ito yung tinitreat ng CBT. Tinutulungan niya yung client, yung patient, na baguhin yung mga negative thoughts na and interpretations na naiisip mo. Now we proceed to the general assumptions of cognitive behavioral therapy. There are 3 general assumptions of cognitive behavioral therapy. The first one is the cognitive approach believes that mental illness stems from faulty cognitions about others, our world, and us. This faulty thinking may be through cognitive deficiencies or lack of planning, or cognitive distortions, or processing information inaccurately. So here, CBT believes that we only have faulty thinking because of the quality of our thoughts. Sometimes, we misinterpret informations that can lead us to problems. The next assumptions is these cognitions cause distortions in the way we see things. Ellis suggested it is through irrational thinking, while Beck proposed the cognitive triad. And the last one is we interact with the world through our mental representations of it. If our mental representations are inaccurate or our ways of reasoning are inadequate, then our emotions and behavior may become distorted. disordered. So here, all in all, CBT assumes that we only suffer from mental illness because of our thoughts and how we interpret or process the information that is happening to us. Our mind is so powerful, and if we can't control of our thoughts, this can cause problem to us and also to the people around us. Here's some overview in cognitive behavioral therapy. It is utilized in treating multiple types of psychiatric problems. The treatment is typically done with 3 and 6 months depending on the problem. The following is the list of psychological problems where CBT has been utilized. What I said earlier, these are the mental health problems that CBT can treat. The first one is depression. Second one is anxiety, eating disorders, anger management, marital crisis, obsessive compulsive disorder, schizophrenia, PTSD or post-traumatic stress disorder, and the last one is chronic pain. As you can see here, these mental health problems have one in common, involve in cognitive problems. And also, there are 5 areas that are believed to be interconnected and affecting one another. For instance, how one feels about a certain situation can cause physical and emotional feelings, resulting in varying behaviors in response. The first one is situations, thoughts, emotions, physical feelings, and behaviors. CBT breaks problems down into smaller pieces to give detailed attention to each part. The techniques aid patients in disrupting negative automatic thoughts and replacing them with more helpful ones. The overall goal is to teach the skill of breaking down negative thought patterns and changing them into a more helpful approach to handling daily lives. So here, you can see CBT always focuses on how we think and how we feel, our actions based on our emotions, like that. And also, these emotions always depends on the situations, our thoughts, emotions, physical feelings, and the behavior, because how we feel is how we interact with others. There are 10 principles of CBT. So the first one, it is based on ever-evolving formulation of the patient and her problems in cognitive terms. Number 2 is CBT requires a good client-therapist relationship. Of course, since CBT requires, the therapist requires to know what the client's thinking, how he feels, like that, they should have a good relationship to build a rapport. So the client are comfortable in opening up to the therapist. Number 3 is CBT emphasizes collaboration and active participation. So since if the client and the therapist had a good relationship, they will have an active participation, so that the outcome of the therapy would be helpful for the client. Number 4 is goal-oriented and problem-focused. This is one of the good characteristics of CBT. It is a goal-oriented and a problem-focused, because at the end of the day, the client know that he or she will be helped. Number 5, CBT initially emphasizes the present. How we feel, how we our actions matters in the present. CBT is educative. It aims to teach the client to be his or her own therapist and emphasizes relapse prevention. Since this is a goal-oriented and problem-focused therapy, the relapse can be prevented. The client know the problem, what his or her problem, and what causes of this problem, and later on, if he will face this again, he or she knows what to do because the therapist already explain or teach them how to. The CBT aims to be time limited. The sessions are structured. The CBT teaches patients to identify, evaluate, and respond to their dysfunctional thoughts and beliefs. So, what I said earlier, since CBT requires a good client-therapist relationship, the client is comfortable in talking to the therapist, and the therapist can tell the client and help the client to identify and evaluate his or her dysfunctional thoughts. And lastly, the CBT uses a variety of techniques to change thinking, mood, and behavior. Since the goal of this therapy is to have change of thoughts, the thinking and mood and behavior of the client, CBT uses a variety of techniques depending on the client's needs, because as I can say earlier, the treatment is customized for each patient with regards to their differences in personalities and specific needs. Since every people is different from one another, we requires different treatment also. We can go to the pros and cons of the therapy. As you know, like any other therapy, there always a risk of a negative emotion returning. So, let's have a look at what's good and what could hold progress back in the treatment. So, let's discuss first the pros or the advantages of this CBT. The first one is, compared to other talking therapies, CBT can be completed in a relatively short period of time. So, unlike the other therapies which requires multiple visits, months, even years, at least CBT requires a short period of time. Can be helpful in treating some mental health disorder where medication alone has not helped improve symptoms. So, as what I stated earlier, there are mental health problems that CBT can treat, but this will just apply if the medication alone has not helped improve the symptoms. Okay. Number 3, in order to make changes in how you feel, CBT focuses on altering thoughts and behaviors. Strategies are helpful and practical. They can help people cope with future stresses. So this is like it emphasizes the relapse prevention. So the CBT can prevent those future stressors. If you encountered this situation again, you'll know what to do. CBT can improve the quality of life, of course. It can be provided in a variety of formats, including in-person, online, or workbooks. It can even be useful in a group setting. So, not all the therapy can be done using online or workbooks or in a group setting, but in CBT, if the client is so busy and don't have time to visit your office, You can have the therapy using online or workbooks, or if the client is uncomfortable doing the therapy on her own, she can be in a group, but still she know that she will be helped. It can be used in almost any age group, of course. And the last one is it may improve emotional processing. Since the CBT talks about the thoughts, the negative thoughts, replacing them with more helpful ones, this therapy can improve your emotional processing. Your emotional being can be improved. So if there are pros of the CBT, also there always a cons, so or the disadvantages. So here's are the list of the disadvantages of the CBT. The first one is the patient has to be committed to the process. There is no magic wand that a therapist might wave to make a patient's problems go away. Of course, all the therapy is the patient should be committed, because these problems we can't just take them away in just snap of a finger. This should be gradually improving their situations, their thoughts, like that. So they need to be committed also. But if the client is not committed to the process, or he or she always has excuses to go to the therapy, it will be useless for them. A drawback might be the individual needs are met through the therapy, but a patient's environment, the family or interactions that might have a significant impact to the patient's well-being is not addressed. CBT could prove more difficult for people suffering from severe mental health difficulties or those with a learning disability. So this one, not all the mental health difficulties can be treated with CBT, especially with those learning disability, because that needs another treatment. The next one is CBT addresses the sources of anxiety or other stress-causing emotions. The initial exposure to this type of treatment could prove uncomfortable. So of course, at the first, before talking to the therapist, it's uncomfortable opening about your problems, about your what you're going through. So the client and the therapist should have a good relationship. They should have a strong rapport to be the therapy will be successful. The second to the last is this treatment does not fully address possible underlying causes of negative emotions, as it focuses on the present problems. So, if you have a client that suffering from a certain distress right now at this moment, the only problem that CBT can treat is that specific problem that she needs to address right now. But the underlying causes of that problem, if because of this one or because of that one, the CBT cannot address those negative emotions, since it is focuses on the present. And the last one is doing the work in real life takes time. Of course, everything takes time. It is a process. Maybe though you are going to a therapy session right now, like that, you should be patient, because it will, like what I said earlier, we cannot just wave a magic wand and then suddenly your problems disappear. No, it takes time, gradually, so that we can prevent these negative emotions or these negative thoughts to surface in the future. And now we can move on to strengths and shortcomings of cognitive behavioral therapy from a diversity perspective. Since cognitive behavioral therapy is developed from a Western culture, applying to a diverse perspective can have some strength and shortcomings. So first, let's discuss the strength. The first one is, if therapists understand the core values of their culturally diverse clients, they can help clients explore these values and gain a full awareness of their conflicting ideas or feelings. So of course, before starting a therapy session, the therapist must and always have to have an idea about the client's culture or beliefs, because this can affect the goal of the therapy. The next one is cognitive behavior therapy tends to be culturally sensitive because it uses the individual's belief system or worldview as part of the method of self-challenge. So what I said earlier, since the CBT will explore your intuition, your thoughts, your feelings, of course, if the culture of the client can affect the therapy itself, because some clients can be culturally sensitive, or they have beliefs like not sharing so much idea, so much thoughts that they have. And because of this, the therapist will unable to have or build a rapport, a stronger relationship with the client. The third one is the collaborative approach of CBT offers clients the structure they may want, yet the therapist still makes every effort to enlist clients' active cooperation and participation. And the last one is, according to Spiegler 2008, because of its nature and the way CBT is practiced, it is inherently suited to treating diverse clients. Some of the factors that Spiegler identifies that make CBT diversity effective included individualized treatment, focusing on the external environment, active nature, emphasis on learning, reliance on empirical evidence, focus on present behavior, and brevity. So, since the CBT is from Western culture, developed by a Western doctor, it is inherently suited, of course, for the diverse client, since it is focuses on an individual, and this helps because since this is individualized treatment, the therapist can focus on the person itself, what its belief, culture, and the like. Now we can go to the shortcomings from a diversity perspective. Actually, there are two. The first one is, applying cognitive behavior therapy to diverse culture pertains to the hesitation of some clients to question their basic cultural values. Since, like what I said, we have different cultural values, some clients may be hesitant in opening up to the therapist because, they have may question their cultural values, since the CBT is only focused on them. And the last one is the Tilio notes that some Mediterranean and Middle Eastern cultures have strict rules with regard to religion, marriage, and family, and child rearing practices. Like for example, we are Asians. We in Asia we have a very diverse culture. We have different religion, beliefs about marriage or family. Filipinos are family oriented, some are not. Child rearing practices. But this can be a problem if the client have this kind of strict rules, because maybe they will become reluctant in opening up about their marriage and family, most especially if the problem is in marriage and family. There can be a conflict between their distress and the environment that they lived in. And now, we can move on to the strength of the cognitive behavioral approaches. The first one is the strength from diversity perspective. Now, this is the strength of the CBT itself. The first one is model has great appeal because it focuses on human thought. Human cognitive abilities have been responsible for our many accomplishments, so may also responsible for our problems. The second one is cognitive theories lend themselves to testing. When experimental subjects are manipulated into adopting unpleasant assumptions or thought, they became more anxious and depressed. Many people with psychological disorder, particularly depressive, anxiety, and sexual disorder, have been found to display maladaptive assumptions and thoughts. And the last one is cognitive therapy has been very effective for treating depression and moderately effective for anxiety problems. So in general, strength of cognitive behavioral approach, because it is focuses on the thoughts, human thoughts, we also have the ability to change it, because of course we are also responsible for thoughts, also responsible for our accomplishments, our desires, our dreams, but also it is also responsible for our problems. And now we can discuss the limitations and criticisms of cognitive behavioral approach. So, the first one is a potential limitation of any of cognitive behavioral approaches is the therapist's level of training, knowledge, skill, and perceptiveness. Although this is true of all therapeutic approaches, it is especially true for CBT practitioners because they tend to be active, highly structured, and offer clients psychoeducational information and teach life skills. So, like any other therapy, the therapist should have the level of training, the knowledge, skill, and perceptiveness, because the therapy is the one who will facilitate or initiate the therapy. The therapy will be successful also if they both, the client and the therapist, work together. The next one is the basic issue is discovering the best way to change a client's internal dialogue. Is directly teaching the client the most effective approach? Is the client's failure to think rationally or logically always due to a lack of understanding of reasoning or problem solving? Is learning by self-discovery more effective and longer lasting than being taught by a therapist? Although we don't have definitive answers to these questions yet, we cannot assume that learning occurs only by teaching. it is a mistake to conclude that therapy is mainly a cognitive process. Experiential therapists stress that learning also involves emotions and self-discovery. So since the CBT will teach you how to give an alternative to your negative thoughts like that, it is said here that is it the only way to have the is it the only way to conclude a cognitive process, because we all know that emotions and self-discovery also is one of the best way to help ourselves. That would be all. Thank you for watching and have a nice day.